Mitral regurgitation is a very frequent disease, and usually treatment is not offered very frequently to the patient. There's a very recent publication on that only 15% of the patient get really treatment, which means surgical treatment or interventional treatment. So frequent disease, it's related to a poor outcome, to bad morbidity and bad mortality data, and then we don't have good treatment. There are two different forms of mitral regurgitation. It's functional or degenerative mitral regurgitation, and most patients do suffer from functional mitral regurgitation. And the leading pathology of functional mitral regurgitation is dilation of the annulus. And therefore, if you want to treat functional MR, you need to reduce the size of the annulus. And this is the feature of the Cardioband system. It's a catheter-based approach with which you can tackle the annular dilation and reduce the annular dimension. By this, at the end of the day, hopefully also reduce mitral regurgitation. A well-controlled core lab adjudicated study has been performed and has been published already, and it showed in 60 patients that the system is, first of all, very safe. So there is no mortality rate peri-procedurally, and secondly, it is very effective. We have seen that in more than 95% of the patients we were able to reduce mitral regurgitation to moderate or even less. Most patients entered the study with severe mitral regurgitation, and what we have also seen is that there was no recurrency over the 2 years follow-up in this patient, which is very important. We worry a lot about recurrency of mitral regurgitation. We are all aware of the surgical data which report recurrency rate up to 60% over 2 years. That was not the case, at least in this Cardioband study. And then we saw clinical benefit as a response to reduction of mitral regurgitation, less heart failure symptoms, better exercise capacity. There is a learning curve, as it is true for any device, as it is true for TAVI or for the mitral clip procedure. You need to know how to go transeptally, you need to know how to interpret the imaging, but then the procedure is not very difficult. To steer the catheter in the left atrium and to put in the anchors is not very challenging. Imaging is challenging, therefore you have to have a very skilled echocardiographer on your side, and you have to be able to interpret all these images yourself. That's the most important thing. We have fulfilled these feasibility studies, we have seen it's working nicely. Now we have to bring it to all other sites so that every interventional cardiologist could also use the system.